Okay, so now that you've been able to kind of visualize a little bit more what those bubbles, the cavitation, and what that like microstreaming, that fluid flowing looks like, let's talk about what that does. So the non-thermal effects of ultrasound. And again, can't emphasize this enough. Every time we use ultrasound, we get thermal effects and we get non-thermal. Based on our settings, we maximize one versus the other. And so when we're trying to maximize the non-thermal effects, we tend to have our pulsed ultrasound with that lower output. When we're trying to maximize thermal effects, we tend to have our continuous ultrasound, 100% duty cycles, and then we use our intensities to help set the amount of heating that we want. So when we're talking about non-thermal effects, again, these are happening even when we're heating. So when you get to doing your competencies, if you're talking about thermal ultrasound, you have to talk about all the thermal effects and all the non-thermal effects, because these are occurring as well. So we get an increase in histamine release, an increase in the calcium ion influx, increased phagocytic activity, so the macrophages are eating up all the waste faster. Protein synthesis occurs quicker. We get increased capillary density in ischemic tissues. So remember that one of our steps in the proliferation phase, right, was all that vascular regeneration, so regrowing all those capillary buds. This helps that. Okay, this increases those capillary bud growth. So vascular regeneration. We get an increase in the number of fibroblasts, which we know are needed for tissue regeneration. So we get increased tissue regeneration, which results in wound healing. Those cell membrane alterations that we talked about with the microstreaming already, and then the attraction of immune cells, like the macrophages, to the area, okay? So basically, it's helping with the resolution of inflammation. We get more breakup of the fibrin. Those bubbles and the flow helps to kind of break up any waste products and make them more likely to then be removed from the phagocytes. Increased in matrix synthesis. We get increased tensile strength in the wound, in the cartilage that we're creating, or the collagen, excuse me, that we're creating, so that those fibroblasts are building. That tensile strength is stronger. And then if we were talking about bone healing and using those settings, we get accelerated fracture healing as well with those low intensity pulse ultrasound machines. So again, those vibrations produced by the ultrasound head, okay, and the ultrasound energy is what we call frequency resonance theory. And those vibrations, so besides all of the things happening on the cellular level, those vibrations have mechanical effects happening on the cells too, okay? Those vibrations help to, again, break up waste. Get all this up here for you. Helps to separate collagen fibers, which increases their extensibility. So if they're really locked up, again, thinking like frozen shoulders or, any kind of joint contracture, any type of just stiffness from injury, right? When all that scar tissue gets laid down, the vibrations help to kind of loosen that up and increase the extensibility of the connective tissues. We also get increased membrane permeability. So again, those vibrations actually change the ionic exchange and create that microstreaming, that movement of the fluid. We also then propagate that vibration, which creates that little bit of the micromassage with the cavitation and the bubbles moving around, okay? And then we get this mechanical breakup. So all those vibrations help to break up the edema and the waste products and allow them to get back into the bloodstream and into the lymph system and out of that area easier. So all of this, okay, everything we've talked about really does allow us to reach the proliferation stage sooner, okay? So we can target, again, during the inflammatory phase, if we try to maximize our non-thermal effects and minimize our thermal effects, we can potentially help push the body through the inflammatory phase into the proliferation stage sooner, and then actually out of the proliferation stage potentially sooner as well. So calcium enters and encourages the release of proteins. Potassium and others move in and out of the cells more rapidly. We get increase in glycosaminoglycan, okay, which is an essential amino acid for collagen remodeling. We get stronger connective tissue that is laid down. We get more collagen synthesis happening. Again, more calcium being uptake by the fibroblasts, which allows them to work and increase their activity level. And then we have this breakup that's occurring and then the increase in macrophages. So all of that, again, accumulating to the fact that we can kind of move through the stages of healing at a little bit faster, more efficient clip.